Hello everyone, my name is Robyn McIntyre and I am the Clinical Nurse Educator in Oncology at Ballarat Health Services, and I'm going to show you how to do a PICC dressing and cap change. First off, we'll have a look at our equipment, and of course before I bring this to the patient bedside I would have cleaned my surface and assembled my equipment. So we need to use Luolox syringes, 10mm Luolox syringes, and I have 3 of those. And I have 3 normal saline syringes, as well as drawing up needles. Now, of course, we won't need the normal saline ampules and needles, drawing up needles, once we go to pre-filled normal saline syringes, which are coming. I also need a pair of sterile gloves to size, a sterile tray. I need a stat lock to secure my PICC when I actually take the old stat lock off. I need a chlorhexidine impregnated tegaderm dressing. The chlorhexidine reduces microflora at the surface of the catheter insertion, thereby reducing infection. I need a new connector to put on the end of the catheter, of which we use a neutron here. I also need our 2% chlorhexidine and 70% isopropyl alcohol swabs, and also our Clinell 2% chlorhexidine and 70% isopropyl wipes as well. And finally, a pair of non-sterile gloves. You may find a bluey or a small waterproof dressing handy to take with you as well. So it's just a matter of, once you get to the patient bedside, of course you do your patient identification, you introduce yourself and tell the patient what you're going to do, and obtain their verbal consent. We do the PICC dressings every 7 days. However, if they are not intact or soiled, we do the dressing sooner. So what I'm going to do, because I have a separate trolley here which I have cleaned, that's where my sterile gloves are going to go, and I'm going to set up my equipment first. I'll decanter all my sterile equipment onto the clean area. Stat lock goes on. Finally, my drawing up needles and neutron. At this stage I might also put a couple of the Clinell wipes on the tray to use for cleaning the catheter. So how I'll actually manage that is just take that dressing aside and pick up a pair of forceps, using my non-touch technique. Open up and just decanter onto your tray. Now, to put a new dressing on, of course, we need to take the old one off. So I'll do my hand wash and put on non-sterile gloves. We don't need sterile gloves for this part of the procedure. So a PICC, of course, is going to be either in either side of the upper arm of the patient. And certainly we'd need to position the patient adequately for us to access the catheter. At this point of time, I just might actually put that waterproof dressing there. And what I'm going to do is use my swabs to wet the dressing and take down the dressing. And then at the same time, once I've taken the dressing off, is clean the primary site. So that's where the catheter goes into the skin. So I'll actually leave those there. I can actually leave these here. Use as many as you need, because we need to make it nice and wet. And start from the bottom, because we need to actually allow the alcohol to dissolve the glue in the dressing. Here we go. Once you make a start on lifting the dressing, just work your way underneath to protect the patient's skin. Now you will note that the catheter is 1.5 centimetres out, so we need to be careful not to allow migration of the catheter while we're changing the dressing and stat lock. Also observe the site for any redness or any ooze coming from the actual catheter site. Now the chlorhexidine gel can be quite sticky, so use your alcohol swab to dissolve the gel and loosen its grip on the catheter. Now at this stage I'm going to fold the dressing in on itself so it doesn't stick to me, and now I'm going to take the stat lock off using the dressing to secure my catheter. So at this stage I might get a new one. I'm going to disengage my stat lock from the catheter, and this can be a little bit tricky because you have to open up the wings and they can be quite tight. Safely disengage your catheter away, and you have to wet this very well. It says remove with alcohol, so we will remove with alcohol. You may need to give it a little bit of time for the alcohol to dissolve the glue, so just be patient and take the stat lock away. And just continue in an upwards motion to loosen the rest of the dressing over the actual catheter. Use another one. There we go. At this point, the catheter is vulnerable to migration, so be careful how you handle the catheter. At this stage, I'm going to use my non-touch technique to clean the catheter site. I'm going to start from the inside. Again, we're going to use gentle friction to create the denaturation of proteins, that chemical reaction with the protein in the skin and the alcohol in our antiseptic swab. Move out as far as you need to, where you know you're going to put the dressing. You can turn it over and start again from the inside. You can go underneath the catheter if you wish. And we need to do this for at least 30 seconds. And while we're allowing that to dry, we can now do our standard aseptic hand wash and put on our sterile gloves and set up the rest of our equipment. It's really important to tell the patient to remain still during this period of time so the catheter doesn't migrate. 20 seconds, and then of course allow it to dry. So now it's just a matter of setting up our equipment quickly. Again, this will be made easier once we get our pre-filled syringes. You won't have to actually attend to this process of drawing up needles on your syringes and drawing up your saline. Syringe. Oops. The third syringe I only need to put a couple of mil in to prime my connector. Prime your neutron connector. Use your sterile gauze here to protect your gloves. Just gently lift and place underneath. Open up your swabs in readiness to use to clean the catheter. And we clean the catheter going from the site of the arm down to the catheter end, the proximal end. So what I will do now, I can actually use my gauze if I wish, but I have cleaned the area, so I can use my finger just to support the catheter here. And with my other hand, just go and rub the catheter in my hands. to clean it. Repeat the process. Now your catheter site, while the catheter itself is drying, you can prepare the site to put your stat lock back on and your dressing. With your stat lock, just loosen the wings because they are quite stiff. We do have a skin protectant. If the patient is allergic to it, please don't use it, but otherwise, yes, it does help preserve the skin from the constant removal and application of the dressing. So make sure, particularly where you're going to put the stat lock, you apply that all around where the dressing is going to go. And of course you must let that dry. And how you can tell that's dry is when the solution stops sticking to your glove. So now it's a matter of putting on your new stat lock and your dressing. Make sure you gently lift and attach the stat lock to the catheter first, to the wing device. Sometimes that can prove to be a little bit tricky. There we go. Press down. Then remove the backing of the stat lock, making sure that you've got no kinks in the catheter itself. And now you can apply your dressing over the top. Make sure that your gel patch goes over the actual insertion site. Again, checking that you haven't had any migration. If you've had the catheter migrate 2 centimetres more in or out, you will need to actually stop, put a dressing over the top and just check the patency of the line. So keep the added dressings here with you because you need to actually document and date your dressing time. So that finishes the first part of our procedure. Now we actually need to take off our connector and replace it. So we'll use our non-touch technique. Disengage our connector. So I'm going to scrub the hub now. Again, we have to do this for 30 seconds. We didn't clean this on the first pass. Try and clean inside the catheter as much as you can, as well as outside. Then we must let that dry. Of course, we use open-ended catheters here, so make sure that your catheter clamp is on any time that the catheter is exposed to the environment. So once that has dried, we can then connect our new neutron connector, unclamp, check for patency, and that's great. We have blood, We'll take the first 5 ml off because we don't want any of the material sitting in the catheter, any of the fluid sitting in the catheter going into our patient if we can help it. So once we've cleared the catheter, we can then do our pulsatile flush. Again, it's that stop-start motion to create turbulence to clean the catheter. Once you get to 1/2 ml, again, you're going to do your positive pressure clamping. Just clamp as you leave the last couple of ml in. Take all your equipment away. Reposition your patient and conclude your procedure. Of course, you'll need to dispose of all your sharps in the appropriate sharps container and all the appropriate medical waste into the medical waste bin.